Welcome to Season 1, Episode 3 of the Home Health Care Today Show. It is our distinct honor and pleasure to sit with the CEO and a long-standing board of director of the National Kidney Foundation of Michigan. Yes. So today, we will engage in interaction and dialogue with both Dr. Silas Norman and Linda Smith-Wheelock. So in view of March being National Kidney Month, we look forward to providing insights to not only homebound patients, but to the greater Metro Detroit community in regards to kidney health. So, Dr. Norman, welcome to our show.
Good afternoon. Happy to be here.
Thank you, sir. Dr. Silas Norman is currently the co-medical director for kidney transplants at the University of Michigan. He's also a transplant nephrologist, and he provides evidence-based programs to University of Michigan patients. He brings over 15 years of volunteer service to the National Kidney Foundation of Michigan. He is the immediate past chair of the Scientific Advisory Board, and he's still an active and engaged board of director. Dr. Norman holds a master's degree in public health, and he's also, of course, a medical doctor. Welcome again to our show, Doc.
Thank you. Good afternoon.
Yes.
Happy to be here.
Thank you. So, Doc, I tried my best to give an overview of your background, which is quite impressive as well as extensive. If I've missed any details, please feel free to share with our listeners and viewers.
So, thank you for that. I think what I would mention is that I'm a native of Detroit, grew up on the west side of Detroit, and in growing up on the west side of Detroit, that helped inform my decision both to go into medicine and ultimately to be a kidney physician, recognizing some of the disease in the community.
Yes.
And the opportunity to help improve care for individuals.
Wonderful, doctor. Wonderful. I'm also a West Side Detroiter. Grew up on Schaefer between Orange Line and Chicago Road. Doc, where did you go to school in Detroit? Renaissance. Okay. I went to King High. Right. East Side, but the West is the best, and the East is still a piece. So it's good to have those similar backgrounds and stomping grounds. Doc, please elaborate a little bit more about the passion that you developed for kidney health at a young age. What were some of the things that you noticed and recognized in Metro Detroit?
So I think that as we're going to discuss a little bit more, we recognize that the major drivers for kidney disease are diabetes and high blood pressure.
Yes.
And we know that there's a high prevalence of both diabetes and high blood pressure in the United States in general, but in particular in the Black community.
Yes.
So certainly recognize that for a young age, even if I hadn't made the connection really to disease. And certainly had the opportunity to see, within, my own family and in the community, sort of the devastation that kidney disease could bring in the community. And then really, would inspire then a passion to see, what you could do, what I could do to improve health and health care for individuals in the community.
Yes.
And I think as we'll talk about, what we know from work here at the National Kidney Foundation is you can really have a transformative effect working to prevent and treat kidney disease.
Awesome, doctor. That is an excellent segue. So as we think about prevention, let's go there. As you mentioned, high blood pressure and some of those leading symptoms or some of those leading comorbidities that unfortunately puts a person in dire straits as related to kidney health. What are some ideas as related to self-maintenance or even managing kidney disease once a person has been diagnosed with it?
So I think you touched on it right there, is that self-care, that self-maintenance.
Yes.
Because ultimately, a lot of the care we're going to do. The National Kidney Foundation promotes a lot of programs, and prevention is really a cornerstone of the work we do. And we know, getting back to this idea that diabetes and high blood pressure are the leading causes of kidney disease, we know in preventing diabetes and high blood pressure, it's lifestyle and exercise is a huge driver of keeping people healthy. Healthy diets, healthy food choices, and regular exercise does a tremendous amount to decrease the chance that people develop diabetes, high blood pressure, and decrease the chances that they develop kidney disease in the first place.
Yes, sir. Very good. And that we've seen in recent news, even during the pandemic, greater emphasis on individuals trying to move around, some trying to remain active, even being homebound, attempting to remain active. Doctor, we see plenty of dialysis centers all throughout our region. What are some of the recent developments that you've seen over the past several years in terms of kidney health, as well as providing support for patients?
Thank you. So perhaps one of the most important things that we've seen over the last several years is just the recognition of kidney disease, of the prevalence of kidney disease, and how it really impacts all of us. Around 1 million people in the state of Michigan have kidney disease. That works out to be roughly 1 in 7 adults in the state. And so, chances are we all know somebody touched by kidney disease. And in rectifying a situation, the first step is recognition. And so there's been increasing recognition of kidney disease, the importance of kidney disease, and the consequences of kidney disease. There have certainly been a number of medical advances, technology advances related to treatment of kidney disease. I think one of the most important things in thinking about preventing and treating kidney disease is the recognition that you need to meet people where they are, go into communities, really understand some of these social determinants of health that have such impact on people's risk of kidney disease, access to care, ability to treat, and really the importance of helping educate people to be their own advocates for health.
Absolutely. And it is encouraging, Dr. Norman, as well as inspiring to understand that kidney disease is not necessarily the end of the road. That there are some interventions that individuals can participate in and with via their primary care physician or via specialist and the like. Doctor, it looks as though you do, quite a bit of surgical procedures at University of Michigan. How would you assist, or how would you help to inform families that may have some fear, angst, and or anxiety in the event that they realize that perhaps they need an invasive type of intervention or surgery?
Sure. So I do primarily the medical management of these patients, but I think it goes back to, again, the patients being their own advocate and really helping educate patients about their bodies, about kidney disease and its impacts, and then helping people understand what are the best treatments for them. Certainly, we always prioritize prevention when possible. But beyond that, some people are going to progress to need dialysis, and then it's helping people choose the right form of dialysis that's best for them, for their lifestyle. And then ideally for those folks who do develop kidney disease, helping move people towards kidney transplant if possible. And again, helping people understand what that entails, how to help them move forward, and then trying to provide people with the resources so that they can better understand their disease, their condition, and how they can best take care of their health.
Awesome, doctor. Yes, and that's where our paths cross as a home health care agency. From time to time, we do take care of homebound patients who have field-based or outpatient dialysis multiple times a week. And then some of our clients even have in-home dialysis. So doctor, in view of some of those homebound patients, should families and caregivers, should they consider, in your professional opinion, should they consider home health care services as a means to help manage their kidney disease?
Well, I think those services can be very helpful to patients. We know that the support that helps keep people in their homes, helps keep people out of the hospital, is tremendously important. And these home health services, again, can help people stay healthy within their home, manage their condition, give them the assistance they need, give their family the assistance they need, who are often working and pulled in a lot of directions, and bringing in some extra assistance I think can be tremendously helpful.
Wonderful, Doctor. We really and thoroughly appreciate not only your contributions to science, your contributions to medicine and patients who you serve through the University of Michigan, but your willingness to go the extra mile by providing volunteer services, leadership, and guidance to the National Kidney Foundation of Michigan. With that being said, doctor, as we close, because I know you're quite busy, are there any additional resources, clinics, specialists that you would recommend for viewers and or listeners in Southeast Michigan?
You know, I would really, as practitioners, certainly we are always helpful to answer any questions from people in the community. But really, as a shameless plug, I would really guide people to the National Kidney Foundation of Michigan site.
Yes.
There's a tremendous amount of information on there that's patient-focused, patient-directed, and also links to a number of other resources that covers everything from prevention, healthy eating, exercise, information about dialysis and transplant, really a wealth of information. I think a good starting point for people to take control of their health and health care.
Wonderful. Dr. Norman, that was not a shameless plug at all. That was a very timely plug because the National Kidney Foundation of Michigan has been so gracious to open up their doors this afternoon to allow us to meet with not only yourself, but also with the CEO, Ms. Linda Smith-Wheelock. So she's next up on our docket after our commercial break. Dr. Norman, we're going to sit with one of your most distinguished colleagues, Ms. Wheelock, and dive into some of those resources that the National Kidney Foundation of Michigan has to offer residents in the state of Michigan. Dr. Norman, it's been a distinct pleasure and honor.
Thank you for having me.
My pleasure. Thank you, sir. Spring is a beautiful time in Detroit and Southeast Michigan. American Advantage Home Care brings that energy, joy, and vitality of the season right into your home, coupled with skilled home health care services. Our world-class team of clinicians can help you to thrive, maintain, and rebound in the comfort of your own home. Finding a home health care agency more compassionate and caring than American Advantage Home Care is a long shot. We're back here in season 1, episode 3 of the Home Health Care Today show. And we're honing in once again on National Kidney Month. So in our first half of our segment, we had a very wonderful conversation with Dr. Silas Norman. But now we're switching gears. We're switching gears to the CEO of the National Kidney Foundation of Michigan, Ms. Linda Smith-Wheelock. Linda, welcome to our show.
Thanks so much for having me. It's wonderful to be here.
Pleasure is all mine. Okay, prior to Linda's tenure as CEO at the National Kidney Foundation of Michigan, she worked as a community services social worker. She has extensive community and outreach experience in the public health realm. Her expertise includes grant administration, program management, evaluation, and fundraising. In 2018, Crane's Detroit Business selected Linda as a notable woman in the not-for-profit realm and sector. Her leadership here at the National Kidney Foundation of Michigan has led to the awards of large grants to help support the foundation and its programs and outreach. She's also been pivotal and key in leading the foundation to develop a partnership with the Center for Disease Control and Prevention's Diabetes Prevention Program. Once again, Linda, welcome.
It's great.
And did I miss anything in that overview of your career and some of those great highlights?
One thing I would add is that it's so important when you're trying to get to those big goals and aspirations to have an amazing team. So we have an amazing team. Our staff are incredible. We have such talent, and I can't, say enough for the volunteers like Dr. Norman. To really be able to do these things, you have to have big partnerships. You have to have incredible physicians who are helping you, and other healthcare personnel and administrators, and we have a lot of that. We've really built on that. Yes. And it's, these kinds of individuals, the amount of time that they spend on the Kidney Foundation, all of the time, I always say to myself, I'm amazed that all of our physicians come, they actually come to these things, and they're tired, and they're on call, and they're working so hard, and yet they come and help us to do the work that we do, to really help change people's lives. And I know they believe in it, and that's why they do it, but can't do it without any of them.
That is wonderful, Linda. Yes, and as board members that support a CEO such as yourself that has a vision and a great team, it is a sacrifice to give that time, talent, and treasure. But for them to continuously do it is a strong testament to their support of you and your vision and your energy. So congratulations for having a strong internal team as well as a strong board of directors. Yeah, so then when we focus on the not-for-profit realm in many respects, some individuals seem to lose sight on the fact that the not-for-profit sector is a for impact sector. Okay, so with that being said, do you mind elaborating a little bit more about your passion and your commitment to serve stakeholders in the state of Michigan? Granted that the National Kidney Foundation is a multi-state national organization, but this is the Michigan affiliate. So please elaborate on your passion for Michiganders.
Yeah, and as Dr. Norman had indicated, more than 1 million people have chronic kidney disease. We know 1 in 3 is at risk of chronic kidney disease. I mean, it's just a huge number of adults that are at risk. And that's the passion of our work, is to really help communities be healthier, to help individuals to live their very best lives. And I am incredibly passionate about people being able to change their lives and live a better life than they were living. And it is so important. The chronic conditions like this, in order to prevent something like kidney failure, you really have to work at it. And it's hard. It's hard for anybody to do. And we really need to be there even more to help people to, have programs that can actually make somebody say, I'm ready to change my life. I mean, it's one thing to get education, and it's another thing to, really say, yeah, I think I'm ready, but to actually be ready and to actually make the change and start to work on your lifestyle to get healthier, whatever that is. I mean, that might just be, I'm going to start walking around the block. Well, that's huge.
Yeah, absolutely.
That's great. It doesn't need to be, you don't need to go run a marathon, but you do need to start getting healthier. And that's what the Kidney Foundation programs are about, and that's what all of our programs are really about, is healthy lifestyle, healthy eating, nutrition, the importance of exercise, helping communities as well as individuals do that. Is what it's all about for us.
Absolutely.
And we can't do that without these partnerships we're talking about. So where are those partnerships in communities? It's churches
Yes.
and community centers and schools, and for us, we're in a lot of early childhood centers, working with children and also their families to talk about important, not only nutrition, education, and physical activity, but really to talk about all of the things that we can perhaps do with our other partners to help people have access to healthy food, have access to safe
Yes.
activity, those sorts of things. Helping child care centers to have good menus
Yes.
that are healthier. So we just do all kinds of work in that way, both community-wise with our partners, as well as working with individuals. And then on the healthcare side, which
Yes.
is another crucial part of our partnerships, it's about working with hospitals on early identification. And you'd think, well, we're already doing that, but no, we really could do much more to help primary care. We need to go to primary care physicians
Yes.
who are seeing these individuals and help them to think about chronic kidney disease and identify earlier, as well as knowing the treatment modalities, but then knowing what Dr. Norman was saying earlier. It's really important for people to be able to manage their condition every day, and they need a high level of support to do that. And so that's where the Kidney Foundation falls to be as helpful as we can to our hospital partners, to our providers, and insurers. Insurers, we work a lot with insurers to
Yes.
help them to think about prevention. That's something in our country that we're
Mhm.
doing better with,
Sure.
but we still put a lot of our focus, on, the end,
Yes.
as opposed to we could really do a lot to prevent these conditions before we ever get there. And so those are where our passion is. That's where our mission is focused,
Yes.
on prevention and helping people live their greatest quality of life.
Wonderful, wonderful, Linda. Now, as I think about some of those insights that you just shared, we understand and recognize that kidney disease affects and impacts youth, teens, young adults, working adults, and even seniors, right? So that is a large sample size of individuals that are impacted. Do you mind sharing a little more detail, a little more insight as to how the foundation is able to help individuals at so many different levels in their walk of life?
Yeah, it's a really exciting journey in the sense of, that we can be there in early childhood care centers and try to find ways to creatively utilize our partnerships with the care centers so that we're not spending hours and hours of time, but rather creating and packaging programs that they can implement, and then helping them be excited about actual implementation. And so we have programs like that for the early childhood centers. We do that with schools as well. And that's how you can get, without partnerships, you can't do these kinds of things in any kind of a large way.
Mhm.
But with partnerships, that's how you can make it happen. And then for seniors and a lot of our individual programming, one of the things that we do is for those programs is we really hire individuals that go through the programs and have done, they've changed their life, they're
Yes.
excited, and they're
Yes.
passionate about what they do. So we actually hire them and train them to lead the programs themselves. And then, you can just continue to expand your reach by doing that.
Absolutely.
And the other thing with, the COVID-19 virus that has occurred, which actually helps to extend things even more. So if there's ever, you have to look for the silver linings, but it's
Certainly.
very difficult.
Absolutely.
But we are using distance learning now, and people are saying, okay, I'll do that. At first it was like, no, I'll wait for us to be back in person.
Yes.
Where all of our programs were in person.
Right.
But now we've all had to kind of say, I guess we have to change if we're going to, move forward in any way. So distance learning, we've really gotten good at that sort of thing. But it also helps reduce some barriers.
It
When
does.
people can't travel, or they have small children, or but they can jump on a Zoom call.
Sure.
And so I think those are some of the, if you will, a silver lining, but those are some of the ways that we've been able to help people a lot during this pandemic, when in the beginning, we all sat back and said, well, how will we do our work?
Yes. So, Linda, as we think imaginatively to a era, hopefully in the immediate future, of post-pandemic, what are some of the goals that you and your leadership team have for the National Kidney Foundation of Michigan?
Well, we're very excited to get back to in-person programming and to be in communities and to do screenings that we were doing before, to helping people to identify what conditions they might have, whether that's blood pressure or diabetes or chronic kidney disease. Those are the kinds of things that we would do before that we really can't always do now, or we have to do in a very different sort of a way. So we're very excited about that, and I think that's going to be the best thing when we can all get back to whatever the new normal is.
Exactly, right? Exactly. Okay, a couple more questions for you, Linda. Whenever it comes to donors, supporters, you mentioned partners and that ecosystem of organizations and individuals that you work with to bring about some good and some value to your stakeholders. How can benefactors, partners, even home health care agencies, and individual donors or corporate donors or just volunteers, how could we be of greater assistance to the National Kidney Foundation of Michigan?
Well, we always need our donors and benefactors. We really can't do the work without them. And we have a lot of generous donors that help us. We have a lot of corporations, and we would love, when we talk about home health, we would love to get more involved in the home health arena. I mean, part of that too is for our people on dialysis or who have a transplant who are utilizing these services. Our chronic disease kind of programs, our programs that focus on self-management,
Yes.
we could work together on that. So
Yes.
I would be real excited about doing that. Another thing to mention for anybody listening who's considering being a donor is that the Kidney Foundation is a 4-star charity from Charity Navigator, and we get we're in the 1% area of all charities in all of the country. We're at the top 1%, and it's a charity that has really worked hard on transparency and excellent governance and financial oversight and all of that sort of thing, so that when people give their money, they want to know, I'm giving my money to something that can really make a difference, and I know that it's going to be a sustainable thing over time. And that's what the Kidney Foundation can bring for a potential donor to think about, or our other donors who might think about remaining involved and committed to us. But we can't do any of this work without them.
Wonderful. Last question for you, Linda. This has been extremely helpful for our listeners as well as viewers on our YouTube channel. Are there any upcoming opportunities, pledges, giving opportunities for volunteers as well as donors to contribute to or to reach out to the foundation for that?
Well, we're always interested in that, and anybody interested can go to nkfm.org. We also have kidney walks that will be coming up. They've been virtual, not surprisingly, over the last 9 months. We're actually hoping in August that we can reconvene virtually at the Detroit Zoo for our kidney walk at the Detroit Zoo. That would be a way we really, anybody can get involved, to help with, developing a walk team is a way that any person could significantly help in the cause. So as an example, the other thing that we are focused on in our future is developing an endowment so that we can have a sustainable amount of funds that would come to the organization in perpetuity. So that's something that our board has decided to move forward with, and we're very excited about that. And so we're always looking for donors that are thinking about those kinds of gifts as well. So any and all are welcome.
Awesome, Linda. Wonderful. And do know that our agency, American Advantage Home Care, looks forward to participating and contributing in any way possible with our employees, as well as letting other stakeholders, external stakeholders and partners know much more about the National Kidney Foundation of Michigan in ways that they can help and assist. Linda, thanks for all of your selfless and tireless work and contributions to this very, very important endeavor, helping to ensure a greater sense of wellness, education, and outreach centered around chronic kidney disease for people of all ages and all walks of life. So, Linda, thank you, and we're always here to help and support you.
Thank you so much for having us.
A pleasure. Thank you. All right, that wraps up Season 1, Episode 3 of the Home Health Care Today show. Once again, we've had the honor and pleasure of sitting down with Dr. Silas Norman and Ms. Linda Smith-Wheelock to explore more about the National Kidney Foundation of Michigan. Please feel free to visit their website at nkfm.org. That is National Kidney Foundation of Michigan.org. Thank you.